Okay, thank you, everybody. I think we're going to get started with the next session. So the UpSmart programme, as Caroline explained, is all about digitising cancer clinical trials. And as part of our role in that as a digital cancer research team at the CRUK National Biomarker Centre, we've been producing these fabulous digital tools for use in clinical trials. And we're releasing those as open source on our website, so you can go and download them as you please. But one of the problems we've been having is how do we now get those into use? So what do we need to do to get those tools used in clinical trials more generally? So in this next session, we're going to be talking about that challenge point. So how do we go from a really good academic idea to a product that is impactful in practice? Luckily, given this is the last session of the day, we've got some very interesting and entertaining speakers. So we should all stay awake. And we've turned the heating down a bit as well, so hopefully nobody's going to be boiling. Well, nobody expected us to need to turn the heating down in Manchester in November. So this afternoon we have John Unsworth from the University of Manchester talking about his experience of successfully spinning out a digital health tool from the University of Manchester. We have Luis Garcia Ganchedo from Evanova to give us an industry perspective. So Evanova, who are focused on digitising clinical trials. How can we learn from how industry are doing this? Then we have Yemi Oviosu from Colonel Farah is going to be talking about some work that he did with the Wellcome Trust last year, the year before, to look at this very problem. So how do you go from a really good academic project to real life clinical impact? And to finish off, we have Hugh Harvey, who will be talking about the regulation that impacts digital and AI healthcare, which can be kind of a minefield, and as we've already been discussing, is very much a fluid state at the moment. So thank you, everybody, for stopping for the second session, and I'm going to hand over to my co-chair, Richard.
Thank you. You forgot to introduce yourself, but thank you, Harriet, just in case there's any doubt about which one of us is which. All right, let's see if I can move these on. Yes. Okay, so as you've heard, this is all about evidence and evaluation, the route to implementation. My name's Richard Stevens. I am the chair of UseMyData and sundry other bits and bobs around the place. First and foremost, I'm a patient. I've had 2 cancers, a heart attack. I've got arthritis in both knees. I've had ophthalmic shingles. That was not one. I went blind in one eye for 3 days and had a lump looking like a Klingon. They actually sent me home from work, not because I might infect people, just because I looked horrible. They should have kept me there for years thinking about it. So I think of myself now as a really rich source of data. As a patient, I have participated in 4 clinical trials. May well get a chance to do another one at some point in my life, who knows. But I'm really interested in what then happens. Having participated in a trial, what actually happens with the outcomes? How soon can we get them rolled out into practice? And actually also what happens to trial data? What's the linkage between trial data and routine healthcare data? And is there any mileage in patients getting hold of it? Now, you heard this morning, in the earlier session, about UseMyData, who we are and what we do. Yvonne highlighted the patient data citation. Now, I've been really pleased to look at all the posters out there and seen how many of them actually thank patients for taking part in a trial. That's wonderful. However, there is one poster that actually uses the patient data citation, and it is from a doctoral researcher, Emma Briggs. So if I may, Emma, just put your hand up because I think you deserve a round of applause. Well done. Get them young, get them early, give them good habits for 40 or 50 years. One of the principles that UseMyData has is this issue of transparency. A few years back, because we have been around for 10 years now, a few years back we came up with some data principles which were actually written by our members, by patients and carers. And I'm delighted to say that these have now been adopted by several institutions in the UK, including people like UCL and 1 or 2 other universities, Leeds being one. But ultimately, it does come down to what Yvonne highlighted this morning, earlier session, say what you do, do what you say. It's a pretty good mantra to bear in mind. Also been asked to talk a little bit about the National Patient Data Day. Had several questions from Yvonne's slide this morning. So, National Patient Data Day. Forgive me if I sound a little bit like Donald Trump, but it's going to be big. It's going to be bigly big. It's going to be the biggest National Patient Data Day ever. We have got Ming Tan coming. Whoa. We have got Piers Keane from UCL coming. We've got Nicola Byrne, the National Data Guardian, and she has said she will come herself, not send one of the team. She will be there in person. We have places available for patients, for carers, also for researchers. We are actually hoping to have a session where researchers who want a bit of patient involvement in their work can sit down with the patients there and actually talk to us about what's needed. That would be really good. How many of you have had cancer in your families? Just show of hands. There you go. See, we talk about data as an abstract. We sometimes talk about researchers and patients as an abstract, but actually it's all us. It's people we know, sometimes it's ourselves, but it's people we care about. And that is why the work we are doing, collecting data and turning it into trials, and then turning the trials into things that make a difference to people we care about, that's why what we do is important. So we start today's session on people who are trying to make a difference. With that, I will shut up and let John Ainsworth start his presentation. Thank you all very much.